Next, I will talk about the management of acute diarrhea. First thing, have lots of toilet paper if possible. This is a joke, but it does emphasize that when one is having diarrhea, dealing with the symptom is what the patient thinks about. They don't think about what kind of diarrhea this is. They just think about how often they're having to pass their bowel movement. The keystone and the main feature of treatment is fluid replacement. And what is known as oral rehydration solutions, ORS. That has been the key to saving the lives of particularly small children around the world, is to replace the fluid that is lost with diarrhea. And the parenteral hydration with intravenous fluid is only needed for very severe dehydration. And when possible, as soon as the person has any appetite, it's useful to feed them, because the food stimulates the intestine to grow new intestinal lining cells that then restore the body to normal function. And symptomatic treatment, oral bismuth, either in tablets or liquid formulations as are available in various parts of the world, has been shown to be useful in treating diarrhea. And anti-motility agents such as loperamide may also slow diarrhea. And then when in cases of severe diarrhea with complications, antibiotics. What is very important, and which I find the most central feature of my treatment of patients with diarrhea, is to avoid caffeinated beverages, which include coffee, tea, chocolate, and cola drinks, because all of these that contain caffeine stimulate the intestine to go faster. I see one of the person in the audience is currently drinking what appears to be coffee and maybe be stimulating their intestinal motility. That can be useful in the general population who doesn't have diarrhea, but it can worsen the intestinal motility in a patient with infectious diarrhea. It also can be helpful to avoid milk products. Many persons who are lactose intolerant as adults cannot drink milk because it is not absorbed and produces diarrhea on a usual basis without infection. However, even those persons that normally can tolerate milk sometimes cannot tolerate milk while they have a viral or bacterial intestinal infection, because the intestinal lining cells are turning over or being replaced so rapidly that immature cells line the intestine that do not have the enzyme lactase to digest milk. After the diarrhea is passed, they can resume drinking milk. It's also helpful to avoid carbonated drinks, such as soft drinks and beer, because the gas released in the intestinal tract by carbonated drinks and beer stretch the stomach, and this produces what's called the gastrocolic reflex. And this is a built-in feature of our digestive tracts, that when the stomach is stretched, it sends a message to the colon to clear out and make room for more food or water that's coming down the intestinal tract. So it's good to have the persons with diarrhea have small meals and not to include something that stretches the stomach and induces even more bowel movements than they are already having. So this diet modification is some of the most useful advice we can give, and often patients who know they need to replace fluids are drinking the wrong things. So this is the most key slide probably of anything I am talking about today. The American Academy of Pediatrics has issued guidelines for diarrhea with no dehydration. They can have a normal diet and then supplemental oral rehydration as necessary after each diarrhea episode. It's interesting that 100 years ago, one of my professors who was in Russia at the time indicated that in a cholera outbreak, all the medical students were sent to help, and each medical student sat next to a patient with cholera, and for day and night reminded them, gave them fluid to drink after each bowel movement, and the patient survived. And this professor told me that it was very important for him to realize that even as a student, that he could save a life by making sure that a person with severe diarrhea replaced as much fluid as they were losing by diarrhea. On patients with mild dehydration, they can be given oral rehydration solution either in clinic or at home. With severe dehydration, it may be necessary to have intravenous fluid replacement, especially if the patient is also vomiting. And that fluid replacement can be with oral rehydration solutions, which are often available as powdered forms in various parts of the world. They are given various names depending on the company that produces the oral rehydration solution powder. And after the powder is reconstituted with water, clean water, it should be used or thrown out within 24 hours because bacteria can also grow in this fluid and make the situation worse. It's necessary to refeed as soon as possible, as soon as they have any appetite, because the food will promote the growth of new enterocytes or intestinal lining cells and will help with repairing the lining of the intestine. It can shorten the duration of the disease. And I mentioned avoiding lactose in milk, but of course, nursing infants have no other source of food and fluid, and so it would not be restricted. And it may not be necessary for older children unless they have severe diarrhea. So symptomatic treatment is for patients who are afebrile and have non-bloody diarrhea. Low pyramide or some other motility reducing medication may inhibit intestinal peristalsis or movement and can have anti-secretory properties. But it should not be used in patients with bloody diarrhea because diarrhea is actually one of the body's methods of getting rid of bacteria that are causing a problem. And so the intestine is trying to clear away the infectious material. And when it is invasive and causing bloody diarrhea, anything that inhibits intestinal movement and clearing out of the intestine may actually make the situation worse. Bismuth subsalicylate may help with nausea, vomiting, and abdominal pain and shorten the duration of illness. Empiric antibiotics or antibiotics given when one does not know the exact source are generally not beneficial and can be harmful. You can, however, consider giving antibiotics even though you don't know what's causing the diarrhea for patients with more than 8 stools a day or diarrhea that's been going on for more than a week. And if those patients are volume depleted and or have known immunosuppression as with HIV or have other warning signs. And some of two of the antibiotics that are commonly given without knowing what the specific cause of the diarrhea may be are the fluoroquinolones or azithromycin. And specific antibiotic therapy is, of course, not used for viral infections because it can't help. It's only used for Campylobacter if it is severe. It's used, when used for Salmonella, can actually prolong the period in which the bacteria are excreted into the stool, and is only used when the infection is severe. It can be beneficial with Shigella. It may be harmful with E. coli 015787. So, summary points: acute diarrhea episodes are extremely common. Most are viral in origin and are self-limited by the mucosal immune response. A good history and physical examination is crucial. Warning signs include high fever, severe abdominal pain, dehydration, and bloody stool. Fluid replacement is most important. Antibiotics are usually not necessary. And one review article about acute infectious diarrhea in immunocompetent adults was produced by Dr. DuPont in Houston, Texas, United States, who has been studying diarrhea for many decades. This is a useful article in the New England Journal of Medicine in 2014. Thank you for your attention, and I will now move on to some additional topics that are of more important to smaller segments of the audience.